Welcome to Between Two Ovaries, your go-to for all things women's health.
A lot of people just say like, oh, my vagina.
Yeah.
And
Yes.
that's all of the above. That's not your vagina.
No.
Well, it is.
We're here to cut through the confusion, bust some myths, and give you the facts straight from the experts.
You cannot still believe the amount of people that come to a gynecology clinic saying that they don't look right down there and they need something doing about it.
We're keeping it real, bringing you honest conversations about topics that matter to you.
Everything goes back to the menstrual cycle. Yes, it's a low-risk procedure, but it's not a no-risk procedure.
From periods to menopause and everything in between, we've got you covered.
So whether you're here to learn, laugh, or just listen, you are in the right place. As soon as I said it,
Hello everyone, welcome back. This episode is all about heavy menstrual bleeding, so we've called it Not Just a Bad Period, Understanding Heavy Menstrual Bleeding. Why are we covering heavy menstrual bleeding? Well, it's a really important problem that affects a lot of women. Periods, a lot of women have them. They can be different. They can be heavy at different times in your life, like puberty, after pregnancy, around perimenopause. But for some women, they have heavy, painful periods all the time, and it can really affect their quality of life. And it can be really common. So 1 in 4 women can have heavy, painful periods. So we wanted to cover this in a very thorough way to give you information about what causes heavy periods and what you need to do if you have them and what treatment options are out there. Mm-hmm. So NICE, who are the National Institute for Health and Care Excellence, define heavy periods or menorrhagia as excessive blood loss which interferes with a woman's physical, social, emotional and or material quality of life.
I like that.
Material. What do we mean by material?
It sounds a bit kind of like vague, but actually it's really important because...
I think it's really
What
important.
does material mean?
I feel like it's like your material is in if you can't go to work.
Yeah,
then you
like
can't
your
pay.
makeup of life.
Like, yeah.
Yeah, but it's good because it used to be that we would try and define heavy periods by how much you were bleeding.
Yeah.
And
Who knows?
It is so difficult.
But this was going to be my next question. What actually is a heavy period?
Exactly. But now we don't say, okay, you don't need to measure your period because that would be really difficult. What we're more interested in is how is it affecting you. So it's more subjective. And I think that's really key to kind of believing women that they have heavy periods.
I think that's really important because I think a lot of people will have been fobbed off with regards to you haven't got heavy periods because you don't fall into this category. But with this definition, I think it's really nice because if you've got periods that are affecting your life in any of these ways, then we're like, right, let's do something about it. I think that's much more better. Much more better. That is
more better.
a much better way of putting it. It's much betterer.
You don't know how much you bleed during your period, do you?
The
It
only
goes
way
into a
that
pad or...
I've ever heard about it is people saying, oh, however many teaspoons or tablespoons, you're not bleeding into a spoon.
Imagine.
Or like, even if you, like, once you've bled, it's usually into your underwear or into the toilet or
menstrual
a pad.
products. Yeah.
So you can't squeeze it out onto a teaspoon. I feel like you just don't know.
You'd have no idea. And I suppose menstrual cups are a little bit more of a way that you can see the blood, but you still don't measure it, do you? You don't know how much is there.
But also, I mean, I've never used one, but how often can you take it out and everything still be exactly as it was when you took it out?
Well, I think like trying to take it out and not getting kind
a
of
little bit
everywhere.
spilling.
That's not perfect.
I mean, you can you can measure, oh gosh, you can, put your teeth in it, measure menstrual blood loss.
Yeah.
So scientifically and for kind of in a research setting, we can measure menstrual loss. But it's not the nicest thing to do.
It's not a cute routine.
No, because you like wear pads and then you keep all the pads and then somebody measures how much blood went into those pads.
Yeah.
Okay.
It feels like a lot.
Not easy to do at home.
You wouldn't be doing that just day to day because you want to know how much
Just
you're
to
bleeding.
track how much you're bleeding, though.
And imagine if you had to do that before you could go and get help for your heavy periods. It wouldn't be ideal.
So you need to put all your pads into this bin and then we're going to get them back out again and we're going to measure how much loss you've had.
No, so it's
And
much
then we'll
better.
decide.
It's how the bleeding is affecting you. If you think your periods are heavy, they're affecting your life, you're flooding through your clothes, you're feeling tired, anemic potentially, then that's enough to get treatment.
There is a cut-off. I know we've just talked about all this where we're like, does it affect your life? All this, it's about you. But from a, again, scientific literature perspective, we say that heavy periods are more than 80 mils of blood loss a month.
Per period, yeah.
But that's such a
do I know how much 80 mils is? Do I know what that would look like?
The other thing I would really know is, like, you know, how much is in a shot if you were going out. So you're trying to imagine your shot glasses. Okay, so like maybe 4 single shots. That would be about 100 mils, right?
Yeah.
Yeah. What about... like, just to give you a visualization.
What about for people that have like really long heavy periods?
Yeah, so that's the other way that they define, so periods longer than 7 days.
Okay.
Yeah.
So if you have a period that's longer than 7 days, or you're losing more than 80 mils, then that's how you would define somebody that has heavy periods. But sometimes, well, a lot of the time, that definition is just pointless, because actually nobody's going to be able to do that exactly.
So what would we say for people at home? How would they know?
Yeah, so if it's affecting your life, so if you're wearing 2 products at the same time, so if you've got a tampon in and you're wearing a pad, or if you've got a menstrual cup and you're wearing a pad, or when you go to bed you're putting down like puppy pad type situations, because you know that you're going to be flooding through. If you're flooding through, any of those things are not normal.
Yeah.
The other things that you might hear quite commonly are like if you're passing large clots.
Yeah.
So some people will not pass any clots during the period. Some people will pass small blood clots that are normal, but if you're passing, a lot of people say like palm-sized clots or bigger than a 50p potentially. Those are bigger than what would be associated with a normal menstrual blood clot. And also things like if you're feeling dizzy and faint when you have or after you had your period, that might suggest that you are losing so much blood that you're becoming anemic. So there's a lot of different things. It's harder to... because obviously in a scientific definition, it's easier to be like, right, more than 80 mils, heavy blood loss. But in real life, it's more really like difficult. What you've just said.
And actually,
how many products are you
for
using?
most people, when we talk about heavy periods, if you do kind of an experiment whereby you ask somebody to pour into a jug how much they think a heavy period would be, people pour like litres. Because they're like, oh, heavy periods must be losing.
Must be loads.
I don't know, 500 mils to a litre a month. And people pour like loads when you're doing like little experiments with people. So losing not as much as you think is a heavy period. So I think it's that, and we've said this about lots of different conditions. If it's affecting your life, then get seen about it.
So if it's affecting, like, if you can go to work, if you can exercise,
if you're avoiding seeing people, like,
your quality of life.
No, not normal. And we've said this before about kind of, for example, exercise. We know that you should be able to exercise at any point of your cycle. We're not saying you have to or you should, but we know that you can. And if your period is stopping you from exercising when you want to exercise, then even that's not a good enough factor. Any of these things all count.
And I guess if you have to be aware, so people are often aware of when their period will be, because even if they're not heavy or painful, they do impact your life a little bit, don't they? So if you know when your period is coming and you're thinking, right, well, I can't go to school that day, or I can't go to work, or I can't do that thing that I want to do with my friends, that's a sign that they're too heavy or painful, and you probably need to think about going on some treatment to help reduce that. So it's how it impacts your life.
And so how common are we, I assume, estimating heavy menstrual bleeding is?
There's a really good campaign called Wear White Again. So if you Google Wear White Again,
you're doing it. The white jeans.
Oh yeah, I'm wearing white. Wear white again.
She was like typing. I was like, no,
I thought you were like, someone's obviously not talking on their period right now.
No, I'm not. I have the Marina coil. Anyway, yes, the Wear White Again campaign is really good. I think it's probably more than 10 years old. It's been around for a while. It tells us that about 1 in 4 women have heavy periods at some point in their life. About 1 in 3 women have heavy periods but don't contact or see a healthcare professional about it because they might not think it's actually a problem. Because a lot of the time people might go to the GP or someone else and be told that it's normal when it's actually not.
Or just assume they can't do anything about it.
Yeah, or just assume it's normal. They might just assume that heavy periods are normal.
Like a familial thing, like, oh, that's normal. That's what my periods were like. That's what your periods are like. This is fine. We get on with it. Wear a tampon and a pad.
Family,
and just because your mum didn't get help for it doesn't mean you don't.
No,
exactly.
Agree.
But really importantly, in this campaign, they've surveyed women, and more than 60% of women who have heavy periods have to miss something like a social activity, exercise, sport, work, which is really sad. It's a lot of women, and a third will miss work just specifically focusing on work for their heavy periods. So it has a massive impact on society, on how women can contribute to the workforce and their careers, their lives. It's a real huge impact for women who have heavy periods.
Because how many of those people have rung up work and said, not coming in today because my period's really heavy? Because they haven't, have they?
No.
Because that feels
so we don't get even like proper
like,
stats for it.
There'll be a certain proportion of people that will, and then there'll be, which I think is amazing, and you should. And if that's the reason why you're not going to work, tell people, because then they can try and think about, if you do want to carry on working, could you be working at home that day?
Yeah, could we make it work for you?
Could we work around it if you want to carry on working? I'm not saying that you need to work if
you're really
that
struggling.
you need the day off. But it will also make a bunch of people feel like really embarrassed that are at work, because you know that there's a group of people being like, oh, do you know that so-and-so's run up because they've got a heavy period? And you're just like, God, it's just, it's back to
there still is so much
drama, isn't it? Like genuine school drama.
Yeah, but there are, I think in a positive way, there are projects and policies that are being implemented in work and in education in some places that are trying to have more of a positive culture around how periods can negatively impact you. That being said, I'm sure it is still really difficult to call up and tell your manager who you're not very close with, who's a man, I can't come in because I've got a heavy period. But that is where we should be aiming for. Like, everyone should feel comfortable to be able to do that, especially if it is so bad that you can't actually work.
It is funny, isn't it? Because you would, I know we're digressing here, but I feel like you'd call up and be like, oh, I've got DMV. And so you've told your boss that you've got diarrhea, but you wouldn't
told your boss that you're pooing yourself.
Yeah.
You cannot leave the toilet.
Cannot leave the toilet today.
But you won't mention, might not feel comfortable mentioning a period. I know, it's crazy, isn't it?
DMV, HMB, what's the difference?
Or you might use the, women's problems. Got the generic women's problems.
Which is such a rogue sentence.
And it could be anything. We have lots of problems. Not just related to our vaginas.
Just life.
Do we need to start a therapy session?
No, I'm good. So yeah, it's crazy.
Is a cause for heavy menstrual bleeding ever found? Always found?
It is found. So in about half of women with heavy menstrual bleeding, a cause will be found. But that also means in the other half, potentially no cause will be found either. And one of the reasons we really wanted to do this episode is and call it heavy menstrual bleeding is because even if you don't know what the cause is, you have something that's affecting your life. There
heavy
are still treatments.
Is a thing.
It is a thing, and you don't have to have a diagnosis to get treatment to make your life better.
I feel like we've echoed this in other episodes. So when we've discussed about chronic pelvic pain, and I think, we discussed this at length about people feeling fobbed off if they have a laparoscopy and they don't find a cause for their chronic pelvic pain. They're kind of like, they don't feel that they've been justified and that they can have pain. And we are kind of massive advocates that if you have a symptom, let's think about what we can do about it.
Yeah.
So what is the symptom that's bothering you? Why are you not able to do X, Y, and Z? Why are you,
how
anything?
Can we help?
Yeah, how can we help? How can we help?
Yeah.
It reminds me of that doctor program on, I think it's on Amazon, where he just goes around as like the medical director being like, what can I do for you? And I'm going, that would be amazing at the hospital if someone's like, what can we do for you? Well, we need the theatre list to run to time. We need this to happen. We need this. We need more of this.
We need just a bit more midwives and nurses, please.
Yeah.
So you'd like a magic genie.
Yeah, but he is a bit like, great, it'll be done next week. Yeah, like he's
sounds
on it.
amazing.
Your dream life.
But I think it's that, and it's not dream life, I suppose, if you come with some stuff, because we'd be like, well, let's try this and see if it helps, because I think a lot of things are trial and error.
Yeah.
But there are loads of things that we can help with.
Yeah, definitely.
So 50% of people we do find a cause of heavy menstrual bleeding. What might that be?
Yeah, so there's lots of different causes of heavy menstrual bleeding. One of them might be something that we could pick up on a scan.
Okay.
So we can sometimes find that someone would have a polyp, which can be an outgrowth of the lining of your womb.
Okay.
So the lining of your womb is your endometrium. Your endometrium is what you shed on a monthly basis. well, you shed some of your endometrium, you keep some of it. But we're getting a bit technical. So when you shed the endometrium, that is your period, and we can find that sometimes people will have outgrowths of the lining of the womb called polyps. You can get polyps other places, in your bowel, up your nose, various different places. And we can remove that, and that could help. So polyps is one thing, fibroids, so people can have these overgrowth of muscular tissue that can again mean that you have problems with heavy periods. Polycystic, go on.
I was just going to say, I'm like very logical, so I like, let's focus on the uterus first, because
Okay,
you've already
go
done
on.
that. You've gone polyps and then you've gone fibroids. So
Like it.
you can also have adenomyosis,
Yeah.
which is when the endometrium grows abnormally into the muscle layer of the womb, and it can give you this big kind of spongy, painful uterus, and that can cause heavy periods as well.
Yep.
Also, as I'm saying all these things, I'm like, we have an episode on so many of these conditions.
Yeah.
So we have an episode on
Same
adenomyosis,
Yeah.
we have one on fibroids, we haven't done one specifically on polyps, but it does come up in our hysteroscopy episode as well.
So when you adenomyosis, just very quickly, so where the lining of your womb is in the muscle layer of the womb, a lot of people have heard about endometriosis. That's where the lining of the womb is outside of the womb. So endometriosis and adenomyosis, people can a lot of times
Evil
have together,
twins?
and
Yeah, we've called them like evil twin sisters, haven't
Yeah,
we?
all cousins.
They are often described as, I think often adenomyosis is described as endometriosis of the womb, but they are separate conditions. There are just some
But they can come
similarities.
together.
Yeah.
They often do come together, yeah, but they might exist separately.
Yeah. So womb, I'm like, what other conditions are affecting the womb? You can have infection.
Infection.
So
yeah.
pelvic inflammatory disease.
Okay.
So a lot of times they can be caused by a sexually transmitted infection.
Yeah.
But they can be caused by other things as well, and that can cause problems with your periods. So it's not just that you would have, well, we've discussed this before about that sexually transmitted infections can rear their heads in many different ways, not just like by smelly discharge.
Yeah.
They can cause problem with periods, and that's something else to think about if you do have heavier periods that have kind of happened like ad hoc rather than just from the beginning of your periods.
Yeah.
Yeah. And endometriosis can cause heavy periods. It more often causes pain, but it can cause heavy periods as well. And also in keeping with the uterus and I suppose their cervix as their neighbours.
Yeah.
Much less likely, but does happen, endometrial cancer or cervical cancer. They can present with heavy bleeding, which might be in between your periods or around your period as well.
So don't ignore this.
Don't ignore it, yes.
Can it also be genetic?
For heavy.
Yeah, so, well, you can have genetic causes of heavy periods for sure. So, PCOS, which again we have an entire episode on, is that we do think there's a genetic link to PCOS. It does tend to run in families, similar with endometriosis. That seems to run in families, but we don't know specifically which genes are actually linked to the kind of familial inheritance of it. But yeah, there seems to be like a genetic link. PCOS.
And other genetic things such as clotting issues.
Yes.
So these things can kind of all affect at different parts of your life as well. So polyps can affect at any part of your life, but they do seem that we see them if you stop your periods and you're postmenopausal and you start having bleeding. A lot of times we'll find a random polyp. So that's when I feel like we see most polyps postmenopausal. So that's polyps. Fibroids you can see throughout your life, but usually kind of 30s, 40s, 50s rather than 20s, but some people do have them in their 20s. Conditions such as endometriosis and adenomyosis. Adenomyosis was always said to affect people when they were much older, like 45, 50, but we've seen it in younger and younger people when we've been kind of looking for it a lot more. And endometriosis, we know it can affect people of all ages. With regards to clotting problems, that is usually from the moment you get your period. So if you're born with a clotting abnormality, you will bleed from the start of your periods. So you will never have had kind of a time frame where the periods were in inverted commas, like normal.
Yeah.
And a lot of people with clotting conditions will know that they have a clotting problem because they will have had bleeding in other parts of their life.
Yeah.
The most common one is von Willebrand's disease. Have you heard of that?
No.
So it's a problem with your platelets, and your platelets are really key to stopping bleeding, so to forming a clot to stop bleeding. So if they don't do that properly, then you'll bleed more heavily in all situations. So I think classically a lot of people might, if they've been to the dentist and bleed quite a lot afterwards, they might be like, okay, there's something going on here, you might have von Willebrand's disease.
Yeah.
You can have a blood test to detect it. But equally, if someone starts their periods and they're heavy, that's one of the clotting disorders that might be causing it.
Yeah. Because if you think your blood, you will carry on bleeding a lot more if your clotting factors aren't working properly. So that's why your period would be heavy.
But in every sense, not just from
just from your periods. Like if you fell over and cut yourself, you would bleed more.
Yeah.
So,
we've also got other systemic conditions.
Mm-hmm.
So things like anything that can affect your hormones. So if you think, so endocrine is usually relating to hormones. So your thyroid is also something that can cause heavy periods. If you have hypothyroidism, so your thyroid isn't working as normal, then that can present with heavy periods as well. It can also make your periods irregular. It can give you lots of other symptoms that are not just related to your periods, like tiredness, skin changes, hair changes. But the menstrual kind of association is heavy periods with hypothyroidism.
I think any condition that affects your whole body. So if you've got something with your pituitary, if you've got diabetes, if you've got any kind of condition that's kind of affecting you as a whole, then it's probably going to affect your periods. Yeah. So that's why it's always worth kind of thinking outside the box if we've not found a condition.
Yeah, and PCOS as well, we would say is a full body condition. It's not just an ovary condition, because it is associated with problems with like insulin resistance, and can increase your risk of getting things like heart disease and diabetes later in life. But it can cause heavy periods because your brain is telling your ovaries to produce eggs, but it keeps sort of starting and stopping. So you get delays in your periods because your periods are triggered by releasing an egg that then doesn't get fertilised, and then all the hormones like estrogen and progesterone decreasing. But if your ovaries are told to kind of start producing eggs and then stop and then start and then stop, it really lengthens your cycle, which means that your endometrium, the lining, gets built up and built up and built up even more. So when you do have a period, it can be heavy.
Right.
So people with PCOS often have irregular periods, maybe not a period for several months, but then when they do have one, it can be really heavy.
Very prolonged sometimes. And we've said before that it's really important that if you've got something like polycystic ovarian syndrome and you're not having regular periods, then you need to see somebody, because you need to protect that lining of the womb, because as Alison said, it gets thicker and thicker, but it could get thicker and thicker and become abnormal. Yeah. So this is when we see people that are younger and they have abnormalities like hyperplasia, so pre-cancerous changes and cancerous changes sometimes in the lining of their womb because they're not having periods. You don't need to have periods. We are massive advocates for people not having periods, but you can't not have periods and not be protecting the lining of your womb. So if you're polycystic ovarian syndrome and you're not having periods, then you need to do something about protecting the lining of your womb.
Like medication.
Yeah. So any hormonal contraception, the coil, or you can induce a bleed at least 4 times a year.
By taking just tablets to help you.
And can any medications cause heavy menstrual bleeding?
Quite a lot of medications can cause heavy menstrual bleeding. So medication that what's the
like
word?
thins your blood?
Yes. Thank you.
Blood thinners.
I love that we're on the same. All I needed to say was medication that what?
I got it.
Yeah, so anticoagulants, so blood thinners. So if you've had a stroke or something like that, you would be on medication to thin your blood, and then that can also make you have heavier periods. They go hand in hand. And then there is, I think, lots of medication. So some medication that affects your liver. Your liver's heavily involved in clotting. So if something's affecting your liver's ability to form clotting agents, then that can also cause heavy periods.
And then obviously when you start any hormonal contraceptive, people can find that their periods will change. If you use the copper coil, your periods can be heavier. So if you kind of do anything to change your periods, sometimes in the beginning there can be up upset to them.
Yeah.
We'll say it like that.
Yeah.
What about
But it
any
should
like
settle.
herbal remedies or supplements or anything?
Yeah, so there are some things, and that's why when you go to, if you see a doctor, they'll say, are you on any alternative treatments? Because there are certain things that people try and take to try and help the periods that can, or the mental health. So there are different medications that are over-the-counter herbal medications that you can get that will affect your periods and affect some of the medications from working. So that's why it's really important that if you see a medical professional, when you're telling them about what you're taking, you're not just remembering to tell them about the ones that you get from a pharmacy, but you tell them
So everything.
the ones that you take.
I feel like you should say everything, even if you're a bit like, is this relevant?
Yeah,
just in
absolutely.
case.
Yeah.
Just in case.
Everything you buy off Amazon, take all your
Everything
supplements.
I buy off Amazon.
Maybe not everything, but they're a while.
They haven't got time.
All your
that's a
whole
daily thing.
stuff.
Yeah. Anything that you're
like
taking as like a supplement,
Yeah.
even if you've just found it online, then you need to tell the GP.
Or like
whoever's
take
asking
pictures
about
of them
it.
before you go and
Yeah.
try
Yeah,
them.
yeah.
Okay. So at what point would you recommend someone to go to see their GP?
Yeah, I think that's going back to the beginning bit when we were saying, if something's affecting your life, seek help. So if you are worried, I think the main one is that if it's affecting your life, but then after that, things that if it's changed, so if you always had periods that were quite manageable and then they've suddenly changed, if you started getting bleeding in between your periods, if you start getting bleeding after intercourse, any of these things you would definitely need to be seen about.
Okay.
But at any other point, if something is worrying you, concerning you, or you're just like, I've had enough, then please seek help, because people are happy to be seen about
Yeah.
this.
So even if you think you've had, actually, I've had heavy periods my whole life, I've done nothing about it, but I can't be bothered with
Now it's
it
annoying
stopping
me.
parts
Yeah.
of my life anymore.
Yeah.
And I'm hearing people talking about it and saying, oh, actually, this could be heavy. Then go see someone.
Yeah, definitely.
Love
And I think as well, thinking about timelines, because often people be like, you might have an infection, like a virus, and then you might have a heavy period, because it can affect the lining of your womb as well. But then your next period might be normal. People saw that a lot with COVID. It caused some
Yeah.
menstrual changes.
Okay.
But not always, well, most of the time, just kind of a sporadic one-time only period, and then goes back to
all
normal.
sorts of stuff.
It sure did. But if these, so say you had normal periods and then suddenly you start having heavy periods, or as Nick said, bleeding in between, bleeding after sex, something different, give it a few months before you go, because it might, and a lot of the time it will probably just self-resolve.
Correct itself,
Definitely if it's been going on for 6 months or more, you need to go and see the GP.
Yeah.
But I think it's difficult. If you're having heavy painful periods and they've been going on for 4 months, I would still say go and see your GP, because you need to go and get something to help you.
And would you suggest people to do like a symptom tracker or keep a bit of a diary, like we've said for other conditions?
Yeah.
It's always useful
Just makes
to
it
advocate
easier,
for
because
yourself.
I kind of think if you get there and you're like, oh, I've had heavy periods for I think 3 to 4 months, and they're like, okay, so how many days do your periods last for? And you're like,
I don't know.
and like it does make it much more straightforward if you're like, right, this is what I have come
Let me
with.
tell you.
Yeah.
Even
This
if you
is
like
my
write it down in
issue.
your notes app on your phone.
Yeah,
or
That's what I
something.
would do. Like, you can have a cycle tracker, but if you don't have to have one of those. You can just write down when your periods were, how heavy they were, the dates, any other symptoms for a few months. Yeah.
So I guess we're going into what can people expect when they do go to their GP, you know, if it's been a couple months and they're like, I can't do this.
Yeah, so I think your GP would go through everything that we've just discussed.
Yeah.
So do you have any, what is the period like? What are you managing to do with regards to, like, do you have to double up on the protection that you're using? Have your periods always been heavy? Do you have any other conditions that could have affected it? Have you started any new medications? Do you have any pain with the periods? Has pain been an issue? How is it affecting you? How is it affecting your life? And kind of go into all these different things to ensure that we're going to be able to treat you appropriately.
Yeah, and they will ask you personal questions. I think it's always good to be prepared. They will ask you when your last period was, so have that written down.
Great.
But they will ask you about your sexual history, because as we mentioned, some infections can cause problems with your periods. So they'll probably ask you if you're sexually active, if you're on any contraception already. They'll ask you about pregnancies, previous pregnancies, terminations, miscarriages, things that might, well, for a lot of people are sensitive topics. You will be asked about, and it's not because we're being nosy, it's because it's relevant to
it is very relevant.
what could be causing your symptoms and what treatment is suitable for you. And also things like your family history, whether you've had a cervical smear recently will be, I mean, they should know that if it's your GP, but good for you to be aware of that.
I feel like they'll just go through it because it's like a bit pro forma-esque with regards to the history, so you would always just say, are you up to date with your smears if you had any problems with your smears?
And they should ask you how it's affecting your life, but if they don't, tell them. So if it is affecting your ability to go to school, work, see your friends, exercise, tell them, because that's really important to get across how badly it is affecting your life.
So from any shortness of breath, any kind of extra tiredness, any headaches, because these could all be symptoms that actually your blood count is on the low side as well. And
any of the weird stuff, because we mentioned thyroid disease, diabetes can cause, so if you've noticed that actually you're really cold all the time and you've lost weight and you didn't mean to, that's relevant too. So it's not just your period, we want to know about you,
your whole
and
self.
you've noticed isn't right about yourself.
And does everyone have investigations, or is anyone just told,
so
you can have this treatment?
Well, not everybody will need investigations. So if you're somebody that's had heavy periods for the last few months, but you've not tried any medications, and there's no symptoms that are red flag symptoms that we'd be like, we're worried about that. So if you, for example, if you started with bleeding in between your periods, you never had that before. If you've got bleeding after sex, you've never had that before. Or if there's been a change in your periods and you're kind of a bit older, if there's symptoms where we're kind of like, we're a bit more concerned about this, then definitely investigation should happen. But if you're somebody who's just like, I'm not belittling at all, but if you're coming through and you're saying, I've got heavy periods, are affecting my life, I would like to try a treatment, then we could start on treatment. And then again, if treatment fails, that's another kind of red flag situation, and we would think about doing more investigations.
And even before investigations, thinking about an examination. I think that's really important for a lot of people who have heavy periods, want to see their GP but might be a bit worried about, well, are they going to look at my vagina? They probably are, and they should. So if you're going with heavy periods, we've mentioned that some of those causes might be things that you could detect on an examination. So when we say examination, it means feeling your tummy, and also maybe doing something like a vaginal examination. So
be prepared. So go in your head, this is going to be a bit like having a smear, in a sense that I am going to get a vaginal examination, because you want to know what's wrong. You're worried enough to go and see a medical professional, therefore you need examining. So, and you're being examined by somebody who's trained to examine people, so
and
therefore
lots and lots
it's really difficult. And going back to that we discussed earlier about diarrhea, I still feel like people would be like, well, I think people would have like a rectal examination and not even be that bothered, like finger up the bottom type examination, whereas like thinking about a vaginal examination, people are just there's so much
too much stigma, isn't there, and embarrassment and shame where there shouldn't be. Like 51% of the population have a vagina, and and they need looking after. But you might and you should have a vaginal exam. So that's to see if there's anything like a big uterus that might be fibroids in there. Adenomyosis can be big and bulky in your uterus. Also endometriosis, there can be signs on examination. So those, having a vaginal exam and a speculum, which is what you have when you go for a smear, the plastic tube inside your vagina to have a look at your cervix, they can sometimes identify the reason for your heavy periods.
You might have a polyp coming out of your cervix, and you might be like, oh, yes, there we go. Like, here we go. We've got a polyp. We'll get that sorted for you. But also, it means that we found it straight away. Or, as you said, you might be able to feel, and you're like, this is a really big, bulky uterus. Potentially, you're going to have fibroids. And it just kind of gives you that warning shot of what you're thinking about. And
relief as well. If it is something.
And if you have something like that on an examination, then you should then have an ultrasound to see if that is
double
what
check
you've
that.
So relief, or in a sense that I suppose you could think of it on a flip side, because if you look at a cervix and it looks really abnormal, then you can kind of say, do you know what, your cervix does look abnormal, therefore I'm going to get you seen in the next 2 weeks
And
and can't
good job
possibly
with
train
finding it.
so that let's try and get this looked at and sorted. The other thing is you can see, and I know we said that not all infections look or seem or you have the same symptoms, but when you sometimes do a speculum examination, you can see that somebody clearly has got an infection, or that they may have an infection, so we can do swabs and get them kind of off to see
and get you
what that is.
treated and get your symptoms resolved.
Yes, exactly.
I wonder, I think we did touch on it when we did the paediatric adolescent gynae, but like if someone's listening and they're taking their, 13, 14-year-old that's just started their periods to the GP, are they definitely going to have, are they going to be able to say no to an exam, like that kind of...
Firstly, anyone can say no to an exam. You don't have to have it, no one will force you, but there are certain people that it'd be less appropriate. So definitely a teenage girl who's not sexually active, it would be completely inappropriate to be like, right, we're going to go and do a speculum examination on you and completely traumatise.
And then she'll never have smears for the rest of her life. And completely inappropriate. But there are other people that should totally have an examination, and we shouldn't people shouldn't be, oh, you're on your period, oh, we won't examine you then.
No.
Why? We need to examine people.
That's the issue
that's
that
why.
we're trying to get to the bottom of.
Exactly.
So it's just like, don't make excuses, and in your head think, I'm probably going to have an examination when I get there.
And it's going to be fine. It's going to all be okay.
It's going to be fine.
If you don't do that, then you're just neglecting a whole part of your body, aren't you? Like if you have a problem with your elbow, you go to the doctor, they have a look at your elbow. If you have a problem with your periods, expect to go and have an examination. And don't worry about it. The person who's doing the exam sees these things all day, every day. And it is important for your health to try and understand what the causes are, potentially.
Definitely.
And obviously, as we said, there are conditions that kind of affect your whole body, not just your periods. So we're looking for, have you got hirsutism, so excess hair, that you might have come and told us about already, but also we can pick that up and notice
You also might not have noticed. Or you might have noticed and just thought it's completely unrelated because why would you think it is?
Have you got lots of bruising? Could that be related to some kind of clotting condition? What's your skin like? Because that all these factors can be taken in thinking about treatment options, but also thinking about what the diagnosis could be. So it's really important that you're going with your periods, but we need to see you as a whole, see how it's affecting, and see what we could do to help.
Yeah. So what other investigations should people expect when they go to the GP for?
So the investigations you have, so first of all, you might not have any. It all depends on what you are telling the GP that you're seeing. So if it sounds like you might have a clotting disorder, like we discussed von Willebrand disease or other potential clotting disorders, you might then need a blood test to confirm that. If you might have anemia, so if you're very tired, more than usual, you're bleeding heavily, you may be short of breath or have any chest pain. Dizziness, exactly. Those things would prompt the GP to do a blood count test. So a blood test from your arm to look at your blood count, which is looking at your haemoglobin levels, and if that's below a certain amount, or ferritin, which is your iron store, then that might indicate that you are anemic and might need some treatment for it. Other blood tests would be to look at if we thought you had something like thyroid disease, problem, diabetes. So it would depend on your symptoms.
Yeah, it would depend on symptoms completely.
Yeah.
But I think most people, if they've come and they've said that they've got heavy periods and they've had them for a long time, would get a blood count just to make sure that they're not anemic, because that's something that we can help you with, and also will make you feel better. And as we've said, the whole point of this is to try and make you feel better. So that's like an easy win situation.
You already mentioned swabs as well, vaginal swabs. So if we thought an infection might be there, you might have a vaginal swab.
You might need to have a smear if you're not up to date with your smears, and the person that's seeing you is trained to be able to do smears as well, and they have the time and the inclination, then I hope that they would do an opportunistic smear. You've got to be within, I say this, you've got to be within your, you can't do, if you had a smear last year and it was normal, we can't do a smear this year. That is not how it works. You have to be within the window of when you should be having it done. But if you come and you say, my last smear was 7 years ago, then we should be doing one today while you're on that couch, and we've got you. So opportunistic in that way, but not opportunistic in a way that we're doing them every year, because basically they just get thrown away because you're not allowed to do them outside the timing windows. So if there is a problem, then they need to be seen in kind of a colposcopy clinic in the hospital rather than doing extra smears.
Colposcopy.
Yeah.
So
The one where they look at the cervix.
Yeah, so it used something called a colposcope, which is like a magnifying glass.
The one where it was like that.
yes,
Yeah. Like the things in the park where you look down but it's got a mirror so
Like
you
a
can see
periscope.
them. Yeah.
So you have a speculum examination, just like you would when you're having your smear, so the plastic tube in the vagina to look at the neck of the womb, the cervix. But then the person doing it will have little binoculars and they'll look down into the extremely magnified colposcope, which shows them in so much detail the surface of your cervix to see if it looks like there's any area that might not be normal. And then you can take a biopsy as well in colposcopy.
So would that be something that you get referred to?
Yeah.
It's not going to happen on the
I don't
day.
expect, like, I know I've just said that I think that they should do X, Y, and Z when you're in clinic. I don't expect them to be doing a
Whip out the
colposcopy.
colp.
No, you need to have a separate appointment. Colposcope, have another appointment for that.
The other thing that everybody gets, or everybody that walks into the hospital, in the women's hospital, will get a pregnancy test.
Classic.
Because you can see why that's a problem. If you've gone with bleeding, people might be like, but I have bleeding.
This is my period we're talking about.
But if it's kind of that it's been a short time that it's changed in, then you can get bleeding through pregnancy.
Okay.
So if
Worth a test.
Yeah,
Tick
it's
box.
worth just to do a test and make sure that we've kind of ruled that out.
And then, as we mentioned, if you're examined and there's a suggestion of there being maybe a fibroid, a polyp, or something structurally in your reproductive system, you should then have an ultrasound to confirm it. But you might actually be requested an ultrasound even if your examination is normal.
Okay. Would that be on the same day as well?
Usually, no.
Yeah.
It would be a referral, so your GP would request one for you, and then you'd get an appointment later on. But the ultrasound would be, as we've mentioned in most of our episodes, usually a transvaginal ultrasound. So that's a probe in the vagina. It is not painful unless you already have some pain, then it can make it more painful. And it's really useful to do a vaginal examination, a vaginal ultrasound, because it can see the cervix and the uterus and the ovaries much more clearly than over your tummy. When you're pregnant, it's easy to see them over your tummy because they're bigger. When you're not pregnant, it's hard. So you would probably have a vaginal ultrasound. If you really didn't want one, you can have an ultrasound over your tummy, but it's usually not as accurate.
And you need to have a really full bladder.
Yeah. If you have it over your tummy, you need a really full bladder. Yeah.
Empty vaginally and full bladder if you're doing a transabdominal, so a scan on the tummy.
Okay.
But like go to an ultrasound expecting that you will have an internal if you
Always.
are happy with that, just because it's just so much easier for us to see things. doing
And would it
internal
feel
scan.
similar to a speculum?
It usually feels less
I was going to say it
uncomfortable.
feels less.
Because the probe is thinner, it doesn't have to open,
And
it
they
just
put
goes
lube
in.
on it.
Oh, yeah, it has a probe cover, which is just like a massive condom, and then lubricant on the top. So, it, if you don't have pain,
Alison looks like she's using a wand right now.
We like all of
I was putting the lubricant on top of the probe.
I like it.
Of course you were.
Decorating a cake, using a wand.
But ultrasound is good to detect things like endometrial or cervical polyps. You can usually see those.
Yes.
You can sometimes see adenomyosis, not always, but you can sometimes see it. You can sometimes see things that might be associated with endometriosis, like if you have the cysts on your ovaries that are endometriosis cysts. Polycystic ovarian syndrome, you can't identify it from just one ultrasound scan, but that can be part of the diagnostic criteria.
So we discussed before that it's not like a one shot. Yeah, you've got to have 2 of the 3 criteria. Although we have been chatting as a group recently that they are renaming polycystic ovarian syndrome. So I wonder if they will re-criteria it.
We'll have to do an
update
PCOS update.
We will, definitely, when the name gets released.
We won't be able to call it PCOS either.
We'll call
Who knows what we'll call it?
I don't know.
Dot update.
To be decided.
TBC PCOS.
And fibroids as well.
You can see fibroids on ultrasound.
On ultrasound, you can see, and you can also usually see where they are. To be honest, if you've got lots of fibroids, it makes it more difficult to see where they are.
Yeah.
Because they can all obscure each other. But if you have one discrete fibroid, you can then see if it's in the lining of your womb, or if it's in the muscle, or if it's outside the womb. And they all have funny names. So if it's outside, it's called pedunculated.
Pedunculated.
And we might also just measure how thick your endometrium is. So that doesn't necessarily tell you what the diagnosis is, but as we mentioned before, you can have endometrial cancer. If your endometrium looks bigger on ultrasound than it should be, then it could be a polyp.
Yeah.
It could just be that it's a bit thicker. And it doesn't mean that there's a problem.
And matches to where you are in your cycle, because it's different at different points of your cycle.
But it can also be a sign that there's endometrial cancer as well. Okay. So it might be that you have an ultrasound that tells you half of the story, and then you need another investigation to find out exactly what it is. And that's usually a hysteroscopy, which is a camera in the womb, and a biopsy.
Yeah. Okay. So they have, when you're premenopausal, we don't specifically have cut-offs for how thick the endometrium can be, because everybody's will differ at different parts of their cycle. So on day 10, you can't be like, day 10 should be 9 millimetres, day 11 should be 12 millimetres. It just doesn't work like that.
Sorry.
No, go on.
I was just going to say, can you have all these investigations if you had a coil?
Yeah.
Yeah. You can have an ultrasound scan with a coil
in. Can you have
a
hysteroscopy with a coil?
Yeah. You might, so it might get dislodged, and you might need another one in at the end. So or you might need to take it out to have a good look around, but you can.
Does the camera just go through next to the coil?
So I love doing a hysteroscopy with a coil in, and I was telling someone genuinely about this when I was operating on Sunday, because you follow the threads up into the womb, so you've got a nice little track of where you're going, but also people are always worried that their coil is not in the right place. And when you go in, and you can take pictures and be like, your coil is beautifully placed. I ran it on Sunday. I had one that was beautifully placed, like totally in the right place, took pictures, and I had another one that was genuinely just out the top of the cervix, like the arms were open here, just out the top of the cervix, and then there was the whole of the womb with no coiling.
So it should be inside your womb, it shouldn't be in your cervix.
So did you do a little
should it just be happily
moving it up?
And just the strings through the cervix?
Strings through the cervix. So it's T-shaped, isn't it? So the body should be nicely in your uterus, and the T, the top, the arms should be at the top of the womb, sort of pointing towards the opening.
Not hugging the end of
not
the cervix.
hugging the end of the cervix. No.
Got it.
No. So yes, you can definitely do that. I can't remember what I was saying before.
Just popped into my mind.
You don't know the thicknesses of the premenopausal,
but for postmenopausal, there are very strict cut-offs with regards to. So if you came in and you had bleeding and you were postmenopausal, then we have strict cut-offs whether if you are or not on HRT, how thick the endometrium should be. So if it's outside of those limits, then you need further investigations. So further investigations, as Alison said, are usually that you would come in for a camera inside your womb and you take a sample of the line of your womb. Sometimes we don't actually need to do the camera test, and we can just take a sample of the line of the womb, and we're just like, oh, that sample was totally fine, we're happy, the thickness was only borderline discharge. Whereas if you come in and it's much thicker, then we might take a Propel and then still do a camera test as well.
Propel is an endometrial biopsy, like a type of biopsy that you can do.
Like a drinking straw.
We have a really good episode on hysteroscopy, which if you're listening to this and you're thinking, okay, I want to know more about that, or I need one of those.
Or you want a recap, listen again.
Have a listen to that, because we go through exactly what you need to know. Yeah.
And I guess feels like a bit of a buzz topic, the big thing. We're talking about a lot of things that the GP might have to refer you on to. How long might people have to wait? What are our timelines?
Yeah, I think this is really difficult. And it's really rubbish, because I think the NHS is amazing. I don't do any private work. I just work in the NHS and have done since I graduated. And I just think it is just so amazing that we can go to the doctors and we can get things done in a sense. But I do totally appreciate that people are waiting a long time, for example, to see a gynecologist, or to have a surgery that's deemed that's not for, say, cancer.
Anxiously waiting as well.
Yeah. And a lot of times waiting for example, a diagnostic laparoscopy, but they're not on any treatments. So you're waiting kind of like a year for something that may not help with the long-term goal, and it's disheartening for the patients and for the clinicians as well. I promise, because I don't really like seeing people that are upset that have been waiting for a long time. So it's rubbish. That said, if you go to the GP, doctor, medical professional, and you are deemed to have for example, as we said, like these red flags, these symptoms that
They're
we would
really
be more
concerned.
concerned about, he'll be seen quickly.
Yeah.
And when we say more concerned, we mean that we want to exclude cancer.
Yeah.
And you'll be
Yeah.
told that, because it's not nice to turn up
that.
at this suspected cancer clinic and no one's explained that it might be that. You don't necessarily have it. It's that sometimes there are symptoms that we know can mean that there is cancer there, and you then need to have a test to exclude it.
Yeah.
So, for example, postmenopausal bleeding would be one of them.
Yep.
You don't necessarily have cancer, and you most likely don't, but you need to have a test to check.
Yeah.
But talking about waiting, referral times being long, it is really frustrating. But actually, heavy menstrual bleeding, you don't always need to be referred to a gynaecologist.
Yeah. Okay.
And it can be really, if you've got a GP or a healthcare professional who sees you, does a full assessment, they can start treatment.
Yeah, totally.
And can change your life by improving your heavy periods, and you might actually not need a referral at all. And also some of these tests that we've mentioned, they don't necessarily need to be done in the gynecology clinic.
No.
They can be just done from the GP.
Okay.
So in a way, it depends on what is causing your heavy periods, but for most people, 50%, there isn't actually a cause. You can have treatment and things
There
will get
and then.
better without having to wait for like the year-long gynecology clinic.
Love that.
Led us nicely on then. What are the treatments?
So loads of treatments, and a lot of the treatments kind of depend on what the underlying condition is or what your kind of wishes are. So again, when we're discussing about like taking a history and making sure that we are aware of kind of we're in the right place for people, you need to know where people are with regards to fertility. So are you trying to get pregnant? Do you want to be pregnant in the next 6 months? Have you finished your family?
Do you not want a baby?
Yeah. Do you
Are you not
want a
interested
baby?
in
Yeah.
it at all?
And I think that can be difficult for people because they might have been trying to get pregnant for years and years and not being able to get pregnant. They might not have a partner, and now you're kind of like, well, do I need to be able to have a baby now?
They might not even know.
Yeah.
And just
So
be like, now I've got to think about this.
yeah.
Yeah.
So it's a question that you do need to think about, because it can just affect what treatments we're going to use, and maybe what referral that you'll make as well. Because actually, if you come in and you say, I've got these heavy periods and they're awful and they're affecting my life and X, Y, and Z, and you say, right, let's think about a hormonal treatment. I think that's going to be really helpful. And they're like, oh, well, I've been trying to get pregnant for 3 years. Then maybe we've picked up something else where you should be getting referred to fertility clinic right there.
Yeah.
So there's more questions to ask when you're talking about treatments, basically.
Yeah.
But we can split them
Yeah, so
into like hormonal, non-hormonal, and surgery.
Okay.
So should we start with non-hormonal?
Yeah. So it doesn't mean that you have to go in this order. You don't have to start with non-hormonal, then hormonal, then surgery. But this is just a nice way of thinking about the different options.
Yeah.
So non-hormonal medications you can have. There are 2 tablets. One's called tranexamic acid.
Heard of that?
And one's called mefenamic acid.
Not heard of that.
So tranexamic acid is a antifibrinolytic. So essentially, long story short, fibrin is something that breaks down your clots. And so if you stop fibrin working, it stops that happening. So it means that your clots are not being broken down as easily, so you're going to bleed less.
Okay.
Helps reduce bleeding.
Would it make you have more blood clots?
So it doesn't make the average person out there have more blood clots, but if you're someone that's more prone to blood clots or you've had one in the past, we shouldn't really give it to you.
As in, like, blood clots in your veins?
Yeah, like if you've had
instead of
a
periods?
DVT or if you've had a stroke, something like that, you
Okay.
shouldn't
DVT,
really have
deep vein
thrombosis, clot in your leg that can travel to your
I'm always like,
lungs.
have you ever had a blood clot in your leg or your lung
Yeah.
before? And people
Yeah.
are like, and I'm like, well, you haven't then. If
so you
if
would
give
know
me an
if you did.
You would know
answer-
if you've had one.
Yeah.
Oh yeah, for sure. Then you'd be
Because you're
blood
on
thinners
treatment for
and-
quite a long
yeah.
time.
Okay,
after
so
you've
can you
had
not
it.
have tranexamic
No,
acid
you shouldn't,
and blood
no.
thinners?
No.
Okay.
But if you're on blood thinners and you have heavy periods, it's probably because of the blood thinners. But anyway, caveat.
So then we'll move on to a different medication.
Yeah, but for most women, tranexamic acid is safe, it's suitable, and it's really effective. So you can just take it if you have regular periods. You can take it the day before your period is due to start, 3 tablets a day for 4 days, and then that helps reduce the heaviness. It's a really safe drug, and it doesn't really have any side effects, so it's great.
Can you take it if you're trying to get pregnant?
Yes. You can, which is a really good thing, yeah. Then you also have mefenamic acid, which is a non-steroidal anti-inflammatory drug like ibuprofen.
Okay, yeah.
So that does help reduce the heavy bleeding, but its main kind of thing is that it helps with pain. But a lot of people will be given tranexamic acid and mefenamic acid together to take on your period. And that can completely change your life.
Yeah.
You might not need any more treatment, and you can stay on that a very long time.
And you can use that every period.
Yeah.
And you can have
Mefenamic acid.
You can have that when you're trying to get
You can
pregnant.
have them, both of them, when you're trying to get pregnant.
Because you're just taking them when you're on your period.
Okay.
So because they're just confined to that little bit, you wouldn't take them
Every day.
during your cycle, like outside your period, and you wouldn't take them when you were pregnant, but you can take them in your period because we know you're not pregnant.
Yeah.
And in your period, if you've got a longer period that says over 7 days, and that's why you've come, can you take them for 7 days or not?
So you should be taking them for 4 days and then stopping, but you can take them for longer, and we do use them for longer.
Yeah.
It would be under advice from your doctor.
Personal advice.
Yeah.
Perfect.
So moving on to hormonal treatments. So NICE, that Alison introduced at the
Guidelines.
beginning of this episode, have actually said that the I'm going to say the Mirena coil because it's like we're sponsored by them. And we are 100% not sponsored by them.
Not yet.
But imagine the progesterone coil, basically, because you can have other brands. There are other brands.
Kylina?
There's lots of different ones. There's like a cheaper Mirena one as well, which is
isn't it? Yeah.
not my favourite, but
Basically
anyway.
the same.
She has
But
a brand
Kylina
logo.
and Jadessa, they're just for contraception. So they don't help with heavy bleeding. Whereas
They're
Mirena,
smaller, aren't they?
yeah, they've got lower dose of the progesterone. But Mirena and Levocert
yeah.
are both treatments for heavy menstrual bleeding.
And from NICE, that is first line treatment.
Yeah.
I love that.
So I like it because I feel like we sing from the hymn sheet of Mirena quite a lot.
I mean, there's a few of them sat in this room.
Yeah, they're all hanging out here. But Mag's not got one.
Hopefully in the right place.
Hopefully, yeah, nicely.
I'll do a scope to check. I really like it. So yeah, NICE agrees.
Yeah,
Yeah.
nice.
We love
Nice.
Nice.
But it's very effective. So having the Mirena coil or Levocert, whatever, is pretty much guaranteed to reduce your heavy periods. And for a lot of women, you will have no periods.
Yeah.
Can we just always caveat that it's not everyone?
Yeah.
Some of us have a coil and still bleed.
Yeah. And it does have so if you have one fitted, then it does have a 6-month bedding in kind of period where it might not actually change anything for the first few months, but give it 6 months. In most women, it will get lighter, improve the bleeding, or potentially stop your periods.
Yeah. Yeah, it can be life-changing for a lot of people. With the caveat, there's always a caveat that some people won't want a coil. Fine.
And this
You
is
know,
what you can't have if you're trying to get pregnant.
No.
You definitely can't have it because it is trying to get
contraception.
pregnant.
It stops
And also, you can't have it if you've got kind of fibroids in the cavity, or it sometimes doesn't work as well if you have a really big cavity as well. So if where your endometrium is very large because of fibroids outside or adenomyosis or all those kind of things, we can try one of these, but they won't have the same effectiveness quite a lot of the time. There's other things actually that some people can't have them. So if you have a uterus where you have, we discussed these slightly in some of the other episodes, so kind of a malformation where you have kind of two sides to your uterus, you can have 2 coils put in, but sometimes it can be quite difficult for that to happen. That can be really frustrating actually, because you put one in, honestly there was one time where I was just like, why did they just keep going in the right hand side? I'm like, it looks like it's going in the left, and then you scan and you're like, no, back in the right.
If you were putting 2 coils in, would you put someone to sleep while you did it?
No.
Not necessarily. You would use ultrasound if you
Yes,
can at the same
to check.
time.
Is it one of the things where you'd go get a coil and you've never had any sort of examination before, so you don't know, and then they're like, oh, you have 2 sides to your womb?
No, because you actually probably wouldn't realise, because you wouldn't routinely scan, so you might just have a coil put in.
Yeah.
That's
The only thing that could happen, which wouldn't be very common, some people have 2 uteruses and 2 cervixes or cervices. So if you're doing a speculum and you're looking and you can see 2 cervixes, I feel like that's the right word, cervices, 2 of them rather than 1, then you'll be like, okay, you need to have an ultrasound scan because you clearly have a congenital anomaly, which is fine, might be no problem, but then you might need 2 coils.
Yeah.
Because could you have a coil in one and then the other womb get pregnant?
Yeah.
Yeah, and also
And
the
even if it's the same
endometrium
one,
could build up on
Could
the
you
other
get
side, so
pregnant
you
in
can
both
still
wombs
have
at the
it.
same time?
I'm sure there's
I
like case
mean,
reports of this.
we're now talking about like all
sorry.
of the.
we should do an episode on this, cover this in a different episode because it is interesting.
Abnormalities and things.
Yes. Yeah,
So-
there are stories.
Coils, levonorgestrel into uterine systems are usually great for most. There are just some people that they won't work for. And actually some people with heavy menstrual bleeding bleed heavily and their coil falls out.
Yeah, that is more common if you have
so-
heavy periods.
Yeah, so that can be a problem
Not
as well.
ideal.
But it's definitely an option.
Yeah, if you want it.
Yeah.
Other hormonal not contraception treatments, which
Yeah.
are often also contraception.
Which are
Pills. So the combined oral contraceptive pill can be used. It is usually a combination of an estrogen and a progestogen. You typically can take them for 21 days and then have a break. And during that break, you would have a bleed. It will still make your periods lighter if you choose to have the break, but you do not have to have a break. You can run the pill back to back and not have a period. If you start to notice that you're getting some spotting, so a little bit of bleeding coming through, then that can be kind of stopped by having a break, just to shed any of the endometrial lining that's built up and then restart the pill and run it back to back.
And that's when we like one period a season, like for a year. Is
yeah.
that-
I mean, you don't have to.
You
Okay,
can
you
run
can
it
just
back to
have-
back for as
yeah,
long as you
back
want.
to
But if you start to
Okay.
get spotting, then it can help
Yeah.
stop the spotting.
Okay.
Yeah.
But people, the combined oral contraceptive pill works so well for so much of the population. And actually, when you take histories from people and they have problems with the periods, they'll kind of say, well, I was on the combined oral contraceptive pill for 10 years and I felt really very well, but I came off for a hormonal detox or to get pregnant or any of
eye
these
roll.
issues.
You do not need a hormonal detox.
No, you don't. But it's that kind of like, well, we could just go back on the pill if you didn't want to get pregnant,
Yeah,
obviously.
yeah.
But yeah, it works,
works
really,
really well.
really very well for people.
And I'm just such a flag for our other episodes, but we have a whole other episode on contraception. And because a lot of these hormonal treatments are contraception, if you want to know a bit more about them, listen to that one because, and it's got a great name, isn't it? It's like Let's Pill the Tea.
Yeah.
Yeah.
Contraception. Because we go into depth into the different side effects and who it'd be suitable
Yeah.
for. and
Yeah,
not
you can
suitable
find the
for.
one for you.
Yeah. Have a
It's like a
listen.
dating website.
And obviously the progesterone and the pill as well. And that's a pill that you take every day. And yeah, pop. That can help with heavy bleeding. Your bleeding can be a bit more erratic sometimes on that. But the bleeding, whatever you have, should be lighter. So it would help with, for example, the kind of bleeding through things, the having to wear two products at the same time, hopefully having to like take time off, that kind of issues. But you can have bleeding a bit all over the place when you're on the progesterone only pill.
And there are other progestogen-based treatments that can be helpful for heavy periods. So you can have the implant, that can help with heavy periods, and the injection, so the Depo-Provera, that can also help reduce your bleeding. Again, there are kind of pros and cons to each of these options, and it'd be choosing the right thing for you. But if you listen to our other episode, you'll hear more about that.
Depo, some people find absolutely amazing because pretty much it always stops your periods.
Naga Manchetti was a big fan, wasn't
Yeah,
she?
Oh
she
yeah,
was.
she showed us that, didn't she?
But it's, as Naga said, it's not something you can stay on for forever because you've got to
Yeah.
think about your bone health when you're on it. But for time periods, it can be amazing. So that is a really good option as well. You can take cyclical progesterones as well to help with bleeding. This is one of the things that says this is an option, but I'm just like, it's very faffy, isn't it, remembering to take progesterones at different parts of the month. I think it's just easier just to take something that
One
you're
thing
taking all
every
the
day.
time.
Yeah, get into a nice routine with it. Yeah.
Yeah, but for someone that would be a suitable.
Time flies by. I feel like you'll just be like, oh, I've forgotten to take it. It was last week.
Yeah.
True.
Some
That's the
people
downside
take-
to things that you have to take.
some
at
people
certain
try to get
times.
things in a rhythm, and like with the HRT, where they will take it for like days 1 to 12 or day 1 to 15 of the calendar month.
You need a good calendar for that.
because it's just
Wall calendar, hand diary calendar, phone calendar.
all of the calendars,
All the reminders.
all of the calendars.
The other hormonal treatment that you can have is GnRH agonist, so gonadotropin releasing hormone agonist, which is an injection that you can take. So you can have a monthly or 6 monthly or 3 monthly. What it does is it shuts down the part of your brain and the pituitary that tells your ovaries to tell your endometrium to have a period. Long story short, it puts you into
Makes
a
you
chemical
menopausal.
menopause. Yeah, but it's temporary.
Yeah.
It's mostly used for women who have pain and heavy periods. We think you might have endometriosis or you have fibroids that are really big and we want to shrink them down before surgery. So for some women, that might be a treatment. It's definitely not first line.
Yeah.
But it might be something that you're offered.
You wouldn't get that from your GP.
No.
If you put
gynecologic.
into chemical menopause, do you have like menopause symptoms?
Yes.
Yes, but you can
Okay.
have a tablet that adds back a little bit of hormone to help reduce the side effects. But yeah, most women still feel...
And that's why you can't take it long
Menopausal.
term, because putting you in menopause at 20 odd for
Detrimental
kind of
for
like
other
6
parts of your
months a
health.
year, probably
Yeah.
fine. But
Yeah.
if you're doing it for a long time, then your bone health is going to be rubbish.
Yeah.
So like you need to kind of when you discuss about like premature ovarian insufficiency, we always need to think about bone health. So we need to add back HRT or add back hormones another way. So yes, for a short-term treatment, not for a long-term treatment.
Yeah.
Comprehend.
Yes.
And just before we go into surgical, let's just clarify as well that we are not going into treatments for things like thyroid disease, diabetes.
Oh gosh,
Yeah.
Because so these are the treatments that are offered to people with heavy periods, whether or not we know exactly what the cause is.
Yeah.
If you do know the cause, there might be a cause-specific treatment that you should have. But these are useful treatments for women with heavy periods.
Yeah. Yeah. And don't involve us kind of being experts on diabetes treatments.
Exactly.
Imagine. They'll be like, no.
So then surgery?
Yeah, so surgery, again, this is a really big conversation about like where are you in your life, because
what do you wanna do?
a lot of surgeries are definitive treatments and you would not be able, or you would be advised against a pregnancy in the future. Therefore we need to kind of think about what's happening. First line for something like a fibroid that's in the cavity, so in the endometrial cavity, we can remove that hysteroscopically. So we were saying put that camera inside the womb to have a look at the line of the womb, and then we can use a device. One of the devices is called a myosure, but other people use different devices to remove that fibroid from the line of the womb. That increases your chance of implantation if you are hoping for a pregnancy, and also decreases your chance of bleeding heavily if bleeding heavily is the problem. So that can be quite a straightforward procedure. You can have it done as an outpatient or an inpatient, so you can have it done asleep or awake. Sometimes you need more than one of these, because you can take like the top of, like when you take like the lid off something, but then it falls in because you've taken like the lid off it. So you would take the lid off the fibroid, it will fall into the cavity, then you would need another procedure to kind of complete the removal. So sometimes it's not that straightforward, but it can be great, and it can be that we could remove the fibroid or the polyp if you've got a polyp, and then we can put a coil in after if you would like a coil in as well.
Yeah. Nice clinic. One size fits all. Well, not one size fits all. One stop shop.
Yeah,
for certain things.
Yeah.
You can also have a hysterectomy. So that's removal of the uterus. Obviously, this would be if you were at the end of you don't want any more children. You know that you don't want your uterus anymore. We do different types of hysterectomy. Hysterectomy literally means removing the uterus, but it might involve removing the ovaries as well. It will involve removing the tubes, because there's no point in leaving your fallopian tubes if you don't have a uterus. So whether or not you have this would depend on what the cause of your symptoms are. If you don't have a cause and you're still having heavy periods and you've tried other things and you want a hysterectomy, you can have one.
Depending on any other comorbidities. So if you're well enough to have a general anaesthetic, because obviously we can't do that
major
awake.
surgery.
And also depending on your weight as well, because if you, but if you are carrying a lot of extra weight, then the surgery can be way more high risk. And if it's not for something like a cancer, then the surgeon might discuss with you about losing weight before the surgery.
Yeah, and because there are so many other options to help reduce heavy periods, that might be that you're advised to lose some weight or referred to a weight loss clinic, and then given some other treatments to help manage your symptoms until you get to the point that you can have a hysterectomy if you want one, and if you're suitable for one. But yeah, if you're perimenopausal, if you're close to 50, then we would probably also remove your ovaries. But before you're menopausal, your ovaries still have some function, and removing them early can actually shorten your life and put you at risk of other things later on in your life. So it's a conversation you would have with a gynecologist, specific to you and your symptoms and your wishes and goals. But yeah, it's one of the options.
I obviously that's the extreme
Yeah.
of the options, and it's the first thing a lot of people like talked about when they come to clinic, and you kind of like there's quite a lot of steps before we need to get to that,
Yeah.
because that is going to completely cure your heavy periods.
Yeah.
No questions asked. That is going to cure your heavy periods, but it could cause other issues.
You might still
So
have pain.
yeah,
Well, if you have pain as well, there's no guarantee
then
that it would
it's
improve the pain.
well, if you're leaving your ovaries in and you've got pain, it's potentially not going to help with pain at all. You might have problems with prolapse after a hysterectomy. You might have damage to your
Prolapse
bladder.
being when you're...
Womb kind of can, or your vaginal walls can become lax.
Because if you remove your womb, you have to remove a lot of the ligaments that hold everything together. So what you leave is a vaginal vault, and if that's not kind of
Supported.
anchored properly, or
floppy.
and that can come out, and that's called a prolapse
So it would come out of
of
your
the
vagina.
vagina. Yeah,
so not ideal.
one of the
So there's
complications.
there's lots of complications that can come with a hysterectomy because it's major surgery.
Yeah, it's
Yeah.
not nothing,
So
is it?
it's something to be kind of considered. The
Yeah.
other thing that you can have about removing fibroids, we've said about removing them from down below, but if you have large fibroids and they're not in the cavity, so they're not within that endometrium, then you will need them removing from up above. So whether that be laparoscopically with the camera that looks through your tummy button and different ports, or open, and that's called a myomectomy, so either an open or a laparoscopic myomectomy to remove one or multiple fibroids, to give you the best chance of having a pregnancy if that's what you want.
Yeah.
We know that a lot of the people that have fibroids removed, they will come back. So if it's a pregnancy that you want, then you should have the fibroids removed and then
Try
for, well, not straight away, because if you've breached the cavity, then we don't want you to get pregnant straight away, because the pregnancy would be really very high risk with regards to uterine, so the uterus, the womb rupturing is what we would
So
worry
you'd be
about.
told like a window.
So
of
yeah,
when's
you would be
best.
told that we need to wait a time before you get pregnant, but also we don't want to wait too long for fibroids to come back again.
Yeah.
Yeah.
So there are like different things, and
Yes.
we might give you Prostep, so we might give you the injections that Alison discussed before to shrink fibroids before you have a surgery, because if not, fibroids can be very big and have a big blood supply. So
you
we
might
would
bleed
like
a
them a
lot.
little bit smaller, so
Because
that
they
we
can
remove
grow
them safely.
huge,
Oh my gosh,
can't they?
massive,
they can be huge.
absolutely
Yeah.
massive.
Endometrial ablation is
Yeah.
another surgical intervention that
Ablation
can...
burning.
Yes. So essentially it would be similar to when you go for a hysteroscopy, and you would always have a hysteroscopy beforehand, camera in the womb.
And you'd have a sample of the lining of your womb beforehand, because we wouldn't want to burn the lining of your womb if there was abnormalities with the lining of
So
your
a
womb.
biopsy.
Yeah.
Yeah,
So you'd have a
endometrial
biopsy
biopsy.
first.
Check
and
that it's
then,
normal. Sorry.
No, I
Yeah,
was just
and then-
thinking, because like that's really important.
Yeah, definitely. And so it's not just you go, you have the ablation that day. You would have a few appointments before to check that you're suitable. But if you are, then you have your hysteroscopy, camera in the womb, either awake with anaesthetic, local anaesthetic and pain relief options, or completely asleep in a general anaesthetic. Then another device gets inserted that burns away the lining of the womb. And when it burns it away and you remove the device, it then comes down and the cavity sort of closes, and then will scar. So you won't then have endometrium that bleeds every month.
Okay.
It also means that if you then needed, so say for example you then 6 months later had some abnormal bleeding, you can't get a camera in usually. It's quite difficult.
You can. They're difficult.
It's tricky.
When I see somebody that's had a previous ablation on a list, I'm always like, oh.
But that's why it's important, as Nick said, to make sure that your
Yeah.
endometrium's normal
Everything's
before you
normal
remove
first,
it.
I see.
Yeah. And also, really importantly, with an ablation, you might think, well, great, I won't be able to get pregnant. You can. So if you're not menopausal, if you're still able to get pregnant, you should be taking contraception,
Yeah.
or your partner should use condoms.
Because if you think that the egg comes out of the ovary, gets wafted into the tube, travels down the tube, the sperm's gone up through the womb into the tube, fertilised in the tube, and then travels down into the endometrium.
Yeah.
So there's nothing stopping a pregnancy,
Yeah.
but the implantation will be completely abnormal because there's no lining of the womb. So
Yeah.
it kind of implants like in the muscle, like it's not a good idea.
Yeah.
So if you've had an ablation, a coil's not a great option for you, or could you
So
still?
You
Or
can put a coil in at the time of ablation, but
Yeah.
it can be problematic. In some people, it can cause pain.
Yeah.
oh gosh,
And then if you wanted it removing, it can be difficult because obviously that scar
Scarring
tissue is
on
there.
it,
Do you think
Yeah.
the scar tissue would form around the coil?
Yeah.
Sometimes, yeah.
Yeah.
Okay. So
But you might not. So you have other options for contraception.
Yep.
So you probably don't really need to. It's not as if that's the only option. So there are alternatives, especially if it might cause problems.
And there's lots of different options with ablation as well, and I think it just depends which surgeon you see and which hospital you go to, because
Yeah.
sometimes people use like a balloon that has hot water in it. Sometimes they use like a device that has like a front and a back, and they both kind of burn the lining of your womb. But there's lots of safety checks before you do it. So as Alison said, you'd have a scan to make sure the lining of the womb, the muscle of the womb was thick enough, because if you think if someone's had like lots of cesarean sections, they might have a really thin bit at the top of
Yeah.
their womb, so they wouldn't be appropriate. So you need a certain thickness so that the heat doesn't go through the womb.
so you're not burning everything else.
Yeah. And yeah, there's lots of different ways that we can do that. Some people absolutely love their ablation and they don't bleed after and there is no problems whatsoever. And then you see some people after an ablation, it's the same after a hysterectomy, off, all different things, and they just don't like it, and they feel that they have cramps and that it causes lots of problems. So it's that, like, it's not a one size fits all, exactly the same with everything that we ever discuss. But because I think if you hear like, oh, I'll just get rid of the lining of my womb, that seems straightforward.
yeah.
But actually it's definitely not for everybody.
Yeah, it's an option.
Um,
And then uterine
yeah.
artery embolization. So that's another treatment for heavy periods. Often things like fibroids it's used for. So uterine arteries supply your uterus with blood. So if you embolize them, you're blocking them off. So your uterus then has a reduced blood supply. So things like fibroids would not be able to grow anymore, would start to shrink. And obviously if you have reduced blood supply, then your periods should reduce as well. It's not for everybody. It can, so if you wanted to get pregnant, we wouldn't recommend it. There are pregnancies that have happened after them, but they're more complicated. You're not guaranteed to get pregnant afterwards. And then you do often have side effects that are not ideal. So a lot of people report lots of discharge, because obviously if there's like a fibroid that then starts to have its blood supply cut off, it can produce lots of discharge and it can be quite smelly. But it can be a really good option for someone who maybe would be
unsuitable for theatre?
someone who's not,
Okay.
fit enough for a general anaesthetic or for surgery. It can be a really good alternative.
Or want to keep
treat.
their womb. Some people
Yeah.
genuinely don't want to have a hysterectomy,
Yeah.
but want treatment for like fibroid or that kind of thing. So
So you can do the embolization under local anaesthetic?
Yeah, so it's
Okay.
like, you probably heard more commonly people having like a cardiovascular stent.
Oh,
my
yeah,
gosh,
a
my
stent,
brain.
yeah.
I'm not a cardiovascular person. But, stenting in the coronary arteries for like heart attacks, that kind of thing. So it's done in a very similar way, interventional
Okay.
radiology. You have local anaesthetic, and then the veins around your thighs and your groin are used to go in under imaging, and then you can embolize the uterine arteries.
it's a
that way.
radiologist that does it.
Okay.
Yeah, we don't do it.
You do not do that.
You can tell we don't do it.
I think that's everything.
All of our
so.
surgeries?
Yeah.
Great.
shall we move on to some myths and questions?
Yeah.
Brilliant.
Do you want to do the first one?
Absolutely. So, do really heavy periods always cause anemia?
Not always, and as we said, heavy periods are subjective, so you might actually not be losing that much blood to make you anemic, but but it is affecting your life. But it can commonly cause anemia. So if you have heavy periods and you're feeling tired, dizzy, short of breath, then go to your GP and get checked.
And the thing is, people don't know for a lot of time, because they've been suffering for so long, that actually they're functioning on a hemoglobin of like 70.
Yeah.
Whereas like if you had a hemoglobin of 70, you'd be like, I can't get up, I'm short of breath.
Yeah.
Like
They've got used to it.
because you're just
gradual
not
decline. Your body adapts.
your body would not be adapted to it.
Okay.
I've seen kind of really young girls with really low hemoglobins
Yeah.
that have just been like la 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 getting on with life.
Just resilient.
Yeah.
But there's very simple treatment for that. Obviously, treat the heavy periods, and also you can have iron supplementation as well, like
Okay.
tablets.
Love that. Can stress make a period heavier?
Not necessarily heavier, but stress can change your periods. And I think that's, like, I don't think you need to wait for 6 months to see a GP if you're worried. Like, I really don't. But the odd period that's heavier, lighter, earlier, later, a bit abnormal, stops and starts, I genuinely would not even think twice about it. You're allowed a blip.
Yeah.
And I would say that stress causes blips
Yeah.
rather
Okay.
than heavy periods.
Bodies are not robots.
No.
We do
No,
have
absolutely
blips. Will my heavy periods get better with age?
Probably not.
Until you don't
worse
get
with
periods.
Until you don't have periods.
Yeah.
But a lot of people find that from kind of 45-ish, and I'm just saying this because 51 we know is the average going through menopausal age in the UK. A lot of people can find changes in their periods, and sometimes they do get heavier.
Yeah, most people would get heavier periods.
Yeah.
And changes in the periods around 45 plus.
And that's why a lot of people that have the Mirena or the same find that it's so great because it just takes you over like this kind of time, so you don't have this heavier bleeding.
Love. We've had is it normal that my heavy periods cause pain in my bum?
Can be. So periods can cause pain in your bum, not just heavy periods.
Yeah.
A lot of people will find that like on day 1 or 2 of their period they might have a shooting pain around the back. But
Like a cramping pain?
Yeah, I mean, people feel it in different ways, but it can obviously, your rectum is really, really close to your uterus, and things that are causing your uterus to cramp can also be felt in different parts of your pelvis.
Yeah.
But it can be a sign of endometriosis. So if it's something that's persistent, that's really painful with heavy or painful periods, then go and get it checked out.
And some myths. So birth control makes bleeding worse.
On the whole, no, but copper coil can make your periods heavier.
Okay.
And probably will. Most people get heavy periods.
Yeah, they
with
do
the
get heavy
copper coil.
periods. The other thing is that when people have like their tubes tied, clipped, removed
Okay.
for contraception, then they're like, since I've had that, my periods have been awful. But a lot of the time it's because before they had that, they were on a hormonal contraception.
That was making
So
Okay.
now they've just got their normal periods. So I think it's always something that I counsel patients about, that you might need to go back on hormonal contraception, not for contraception, but for your periods.
But most birth control, hormonal contraception actually makes your periods lighter.
Yeah.
Love. This one's funny. It's not serious unless I'm in severe pain.
Yeah.
So no, you can be
good.
in pain that's not severe, and it might not be serious, but it might be something. It should be something that is making you go to the GP. Oh my god, you should go to the GP if you have something that's painful.
You could have super heavy periods that
Yes.
are not super painful.
Some people really don't get pain with their periods, but they will still have very heavy
And
periods.
like they can't do their everyday activities because of their massive blood.
So no, you don't need to have pain.
If my cycle is regular, the bleeding can't be abnormal.
Again,
No.
Not true.
You can have regular periods and heavy periods at the same time.
Surgery is the only real treatment.
I mean, we've just spoke about treatment for...
Literally.
Yeah.
Surgery is actually possibly not the right treatment for heavy menstrual
Yeah.
bleeding. There's lots of other options that can be less invasive and more effective.
Agree.
It might be the right option for you. Yeah.
And then finally, exercise causes heavy bleeding.
No.
I wonder where this comes from. You know, like people who are on their period who go for a run might notice that they have bleeding at the time of the run because of gravity.
Yeah.
But because they're stood up and they're not sitting down. I don't know. It doesn't. Exercise doesn't cause heavy
exercise,
periods.
again, we've said each to their own, but can help sometimes because of like the good situation that it proves in your body. It can make you feel better about your period. It can make cramps less if you feel up to doing exercise, but it wouldn't make your period heavier.
No.
And you can't like make your period less.
And we've said this before, you
Run,
can't push it
episode.
out to get it out in 3 days.
No, that is not true. That is a terrible myth.
Actually not true. But I think that's everything.
That's covered everything. That was good.
Fab.
Cover of heavy
I feel
menstrual
like
bleeding.
I've learnt a lot.
Good.
So, a quick disclaimer as always, everything we've discussed are our own opinions and they're not affiliated with where we work, and anything that we've discussed shouldn't be taken as personal medical advice.
Yeah, so if you've enjoyed this episode, if you've learned something about heavy menstrual bleeding, please do remember to leave us a review wherever you get your podcasts.
It might seem like a little thing, but giving us a 5-star review really pushes the episode out and all our content, which means that more people get to hear all about the good information that we're trying to spread.
And we want this episode and all of our episodes to reach as many people as possible. So if you want to be part of that ripple effect, then please hit the like button now.
And make sure you're following us on all of our social media pages and all of our platforms at Between Two Ovaries and engage with our content.
Thanks.
Thanks.
Thank you.